you know you're getting fat when you start crashing through the floor. All right. Well, tonight I'm going to talk to you guys a little bit, give you guys a little update about what's going on with me and this rare disease I have. So for those of you that don't know, about a year ago, I think it's almost been a year, I got diagnosed with a rare disease called polyarteritis nodosa. Basically what it is a form of vasculitis. Mine is systematic, so I think I pronounced it right, systematic. So it affects my immune system and it also affects my veins, particular my veins in my leg. So I have this weird looking bruise kind of thingy on my leg, my right leg, and it's really painful to walk on, like the muscle. I have no feeling whatsoever in the bruise part. I don't know what happened, but my nerves are just dead or something. I don't know. So I have no feeling there. Can't walk on my leg. Well, I can't walk on my leg anyway. Can't walk on my foot because it's sore, the muscle, and my joint there, it swells and it gets sore. But I guess one of the symptoms is arthritis, and unfortunately I take after my grandmother and I have arthritis too. I had it since I was 16. Fun, right? So anyway, I just had to see what Piper was doing. So it's been a long journey, struggle, let me tell ya. I was working as a veterinarian assistant, my dream job and what I actually went to school for, but unfortunately that was a whole thing. Like, I got fired, but I also quit. So I guess, like, he said, the boss just said, well, you know, like, when I need you here, I need you to be here when you're here. And I couldn't work the long hours either because my leg was really bothering me, still is. So I kind of said, you know, I'm not going to be able to work the long hours and I'm having trouble like standing on my leg anyway. So we just both came to an agreement that I can't do the job. And it is kind of heartbreaking because it is what I study for. Piper! Stop digging the bed! Stop it! Yeah, so it's kind of heartbreaking because, I mean, that's what I went to school for. That's been my dream since I was 6 years old. So I've been kind of going downhill from there. Lost my job. I have no money whatsoever. I've been trying to find little side hustles to do, but that's not really working out at the moment either. I tried getting what we have here in Canada. It's called employment insurance. Tried getting that, but they said where I quit, I can't get it. But technically I didn't quit. Technically I did, but I didn't. I don't know, confusing situation. So couldn't get EI. I'm trying to go on what we have in Canada also is disability, CPP. Trying to go on that, but here's the thing. Now this is a whole nother story. This is what healthcare really is like in Nova Scotia. We have a problem, like a huge problem right now. I don't know what it's like in other parts of Canada, but in Nova Scotia, man, it ain't good. So I'm not gonna release any names or anything, just because currently my dermatologist, he's the one who diagnosed me with this disease. Him and my family doctor are in a fight. My dermatologist wrote my family doctor a nice little letter, and this is how the story went. So, called up my family doctor because I want to see a rheumatologist because they're also involved in these cases where people have what I have. And like I kind of want like a whole team, you know, helping me out, because right now I basically only have one doctor helping me out who's not supposed to be helping me out because it's not his job. So anyway, so what's happening is, wait, I lost my train of thought, guys. What's happening is, so the dermatologist, he's only supposed to like help me with a treatment plan and like look at my leg and say, and my blood work, and say, okay, this is good, da 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 da. What my family doctor's doing is pushing it all off on the dermatologist, telling him to do everything basically. My dermatologist hasn't been sending him any of the records either. I don't know why, but I told him to send my family doctor the records. So my family doctor's upset because of that. But the thing is, when I first had this thing happen, my family doctor didn't even see me in person because of COVID. Well, like, I can't do COVID because COVID's real, but he didn't see me in person because of COVID, but yet my dermatologist was seeing me in person throughout this whole time. Anyway, so he told, it was a phone appointment, and he's like, oh, it's just a bruise, you're fine. Well, no, I'm not fine. I've been having this for a year, been having like really bad symptoms. It's been making me sick. I'm weak all the time. I'm always complaining about my stomach hurting. I am in pain every single day, not immense pain, but you know, enough to bother me. I'm weak all the time. I think I already said that. So anyway, he hasn't seen me, hasn't, you know, really been involved in this case anyway. So he's like, oh, I want to see your reports, da da da. So I told my dermatologist to send him the reports. He's doing that. But I also, when I had this appointment with my family doctor, I asked if I could see a rheumatologist, because that's who specializes in these things. My family doctor says, no, you don't need one. I'm pretty sure the dermatologist knows what he's doing. I talked to the dermatologist about it, and he said it's not his job to refer me to a rheumatologist. It's actually my family doctor's job. And he's a little annoyed that my family doctor isn't doing his job. He's, like I said, pushing me off on my dermatologist. I want to say this. My dermatologist has been amazing. Like, I couldn't thank him enough right now, because he's going above and beyond what he should be doing. Like, what he gets paid for doing, he's going above that. And he's kind of like standing up right now though, because a lot of doctors have been using him, kind of like how mine is using him. So fast forward to now, another problem. I can't go on disability apparently, because my family doctor won't even sign my papers, because he said I ain't gonna get it anyway. Last time I checked, that is not their decision to make. It's okay, Piper. It's the government's decision, not a doctor's. And I talked to my dermatologist about it, and he said I should be eligible because what I have is a form of vasculitis, and that falls under one of the section things. So me and the secretary got into it of my family doctor, because she's saying I can't go on it, I'm saying I can. She's saying I filled out the wrong papers, I'm saying I didn't, which I didn't. So I had to go through this process. It's okay, Piper. Hold on, I will be back. I had to go through this whole process of, oh my gosh, falling down apparently. Okay. I had to give her my letter stating that I applied for the right thing, that they sent me. And then it was still like, well, I don't think you're gonna get it because you gotta pay into it, you gotta be 65, blah blah blah. I looked into it. No, you don't have to be 65. Yes, you do have to pay into it, but I believe I already have been paying into it. So anyway, there's that. I don't know if I'm gonna even get that. So right now I'm just in a big struggle. I have $0. This YouTube channel isn't really working out. I can't get as many subscribers as you need to make money. So right now I'm just kind of stuck on where to go. I'm trying to open up my own business, but with no money, you can't open up your own business. My credit score is completely horrible. But I think everyone my age, their credit score is horrible too, so I ain't alone in that. So I'm just in a huge kerfuffle right now. Everything's really difficult. I guess well, my belief, I'm a Christian, so right now I'm just letting go and letting God. That's all I can do right now. I can't really do anything else other than that. It's kind of hard for me to get around. I've been hobbling on crutches here every time I go out because it's hard to walk on my leg, foot, I don't, you know what I mean. But I swear I just ADD kicking in. I got fish and I'm looking at them right now and I don't know. But so that's kind of my story about what's been going on. Oh my gosh, I just realized. Okay, sorry guys, but that's what's been going on. Little update. There is some good news though. Other than the pain, my leg is looking so much better. It's healing. Like the bruise coloration of it is turning color, and the dermatologist said that's good. Like it's turning pink. I got a new vein growing. I don't know. I don't understand any of this disease or whatever. I've been trying to do research on the whole thing, but I guess I'm starting to go in remission, what they call it, I think. Like I said, this is all new to me. I know nothing about this. Nothing. All I know is that if it's not treated, I can die within 5 years, and that's something I don't really want to think about. So if I randomly just, you know, go missing and stop posting, yeah, it's probably not good. I ended up going, actually, because of my leg pain, I ended up going all the way to a bigger city, Halifax, to the QE2, which is supposed to be a better hospital. Yeah, no. I went in there, emergency, 7 hours I spent in there. 7 hours. From night until daylight, afternoon. And I told them my symptoms, my problems. They basically said they couldn't do anything. The doctor dangled a paper and said, well, here's a referral, but it's not going to do anything. Another thing about this health crisis, it ain't just me going through problems. I can't remember the lady's name, but a lady in my community, her husband ended up passing away from a heart attack. I can't remember the whole story right off the top of my head, but she called 811. It's like a number, it's not like 911 of course, but it's like you talk to a nurse and they tell you what to do and da da da. I guess she didn't get an answer and they put her on hold and something. So her husband really wasn't doing good at this time. She called 911 and it took the ambulance. It took the ambulance a few hours to get to her house, or an hour or two. Anyway, a long time, and her husband was having a heart attack. And when the ambulance got there, he was DOA because they took so long getting to him. So that's a difficult thing in the community right now. He probably would have made it if the ambulance would have gotten there on time. And if, like, the fire departments, they have the training for it too. So if they were allowed to go to the scene, it would have been better. So I don't know if the government, Nova Scotia government's trying to figure that out or anything, but we in a crisis right now. Not only is COVID going on, but yeah, this health crisis. Oh, and gas. Don't even get me started on that. So yeah, that's all that's going on in my life right now. What's going on in your guys' life? Leave comments, send me a message. I don't know. Help me come up with some ideas, because I am going stir crazy. I've been locked up in this house. I can't go out anywhere because of my disease. I'm immunocompromised. So that's fun. If I get sick, I could die. If I get COVID, I could die. Yeah. Can't be around anybody with any infections. Can't be around anybody who has had any live vaccines. So basically, I'm just confined to my house, gaining weight because of my medication that I gotta take for this disease. It's just not fun. So please, somebody keep me entertained, give me some ideas. I do have a few ideas, but they mostly involve going out and money, which I do not have. So yeah, hit me up, follow me on Instagram. I'll link my stuff below, and I hope you guys all have a good night, good day, whatever it is. Peace and love. Thanks for checking out my channel in this video.